It is part of the pelvic cavity below pelvic diaphragm. Perineum is diamond-shaped and is bounded anteriorly by symphysis pubis, posteriorly by tip of coccyx, and laterally by ischial tuberosities. It is divided by imaginary line between the ischial tuberosities into anterior urogenital triangle, posterior anal triangle, perineum, anal triangle. Anal triangle is bounded behind by tip of coccyx and on each side by ischial tuberosity and sacrotuberous ligament, overlapped by border of gluteus maximus muscle. Anus, or lower opening of anal canal, lies in midline, and on each side is ischiorectal fossa. Skin around anus is supplied by inferior rectal, hemorrhoidal, nerve, lymph vessels of skin drain into medial group of superficial inguinal nodes. Perineum, anal triangle. Anal canal, it is about 1.5 inches, 4 centimeters, long and passes downward and backward from rectal ampulla to anus. Except during defecation, its lateral walls are kept in apposition by levator muscles and anal sphincters. Relations posteriorly, anococcygeal body, which is a mass of fibrous tissue lying between anal canal and coccyx laterally, ischiorectal fossa anteriorly, in male. Perineal body, urogenital diaphragm, membranous part of urethra, and bulb of penis. In female, perineal body, urogenital diaphragm, and lower part of vagina. Structure of anal canal. Mucous membrane of upper half of anal canal, is derived from hindgut endoderm and has following features. 1. Lined by columnar epithelium. 2. Thrown into vertical folds, anal columns, joined together at their lower ends by small semilunar folds, anal valves. 3. Nerve supply is like rectal mucosa by hypogastric plexuses, and it is sensitive only to stretch. 4. Arterial supply, superior rectal artery, a branch of IMA. 5. Venous drainage, superior rectal vein, tributary of IMV. 6. Lymphatic drainage is along superior rectal artery to pararectal nodes. Structure of anal canal. Mucous membrane of lower half of anal canal, is derived from ectoderm of proctoderm and has following features. 1. It is lined by stratified squamous epithelium, which gradually merges at anus with perianal epidermis. 2. There are no anal columns. 3. Nerve supply is from inferior rectal nerve, sensitive to pain, temperature, touch and pressure. 4. Arterial supply, inferior rectal artery, a branch of internal pudendal artery. 5. Venous drainage, inferior rectal vein, a tributary of internal pudendal vein, which drains into internal iliac vein. 6. Lymph drainage, medial group of superficial inguinal nodes. Pecten egg line, is upper half of anal canal joins lower half. Structure of anal canal. Muscle coat, outer longitudinal and inner circular layer of smooth muscle. Anal sphincters, part of circular muscle coat and has an involuntary internal sphincter and a voluntary external sphincter. Internal sphincter is formed from a thickening of smooth muscle of circular coat at upper end of anal canal. It is enclosed by a sheath of striped muscle that forms voluntary external sphincter. The external sphincter can be divided into 3 parts. 1. Subcutaneous part, encircle lower end of anal canal and has no bony attachments. 2. Superficial part, attached to coccyx behind and perineal body in front. 3. Deep part, encircles upper end of anal canal and has no bony attachments. Puberectalis of two levator muscles blend with deep part of external sphincter. Structure of anal canal. Longitudinal smooth muscle of anal canal is continuous above with that of rectum. It forms a continuous coat around anal canal and descends in interval between internal and external anal sphincters. Some of longitudinal fibers are attached to mucous membrane of anal canal, whereas others pass laterally into ischiorectal fossa or are attached to perianal skin. At junction of rectum and anal canal, internal sphincter, deep part of external sphincter and puborectalis muscles form distinct ring, anorectal ring, which can be felt on rectal examination. Anal canal. Blood supply and lymphatics of anal canal arteries. Upper half by superior rectal artery, branch of ima, lower half by inferior rectal artery, branch of internal pudendal artery, veins. Upper half is drained by superior rectal vein into inferior mesenteric vein, lower half is drained by inferior rectal vein into internal pudendal vein. Lymph drainage. Upper half drains into pararectal nodes, then inferior mesenteric nodes. Lower half drains into superficial inguinal nodes. Nerve supply of anal canal. Mucous membranes. Upper half is sensitive to stretch and is innervated by hypogastric plexuses. Lower half is sensitive to pain, temperature, touch, and pressure and is innervated by inferior rectal nerves. Involuntary internal sphincter is supplied by sympathetic fibers from inferior hypogastric plexus. Voluntary external sphincter is supplied by inferior rectal nerve, a branch of pudendal nerve, and perineal branch of fourth sacral nerve. Anal triangle, ischiorectal fossa. Ischiorectal fossa, ischioanal fossa. It is a wedge-shaped space located on each side of anal canal. Base of wedge is superficial and formed by skin. Edge of wedge is formed by junction of medial and lateral walls. Medial wall is formed by sloping levator muscle and anal canal. Lateral wall is formed by lower part of obturator internus muscle, covered with pelvic fascia. Contents of fossa. 1. Dense fat, supports anal canal. 2. Pudendal nerve and internal pudendal vessels, are embedded in a fascial canal, pudendal canal, on lateral wall of ischiorectal fossa, on medial side of ischial tuberosity. 3. Inferior rectal vessels and nerve, cross fossa to reach anal canal. Perineum, nerves. Pudendal nerve, branch of sacral plexus, leaves main pelvic cavity through greater sciatic foramen and then enters perineum through lesser sciatic foramen. Nerve passes forward in pudendal canal. Branches inferior rectal nerve, runs medially across ischiorectal fossa and supplies external anal sphincter, mucous membrane of lower half of anal canal and perianal skin. Dorsal nerve of the penis, or clitoris, perineal nerve, supplies muscles in urogenital triangle and skin on posterior surface of scrotum or labia majora. Perineum, vessels. Internal pudendal artery, it is a branch of internal iliac artery and passes from pelvis through greater sciatic foramen and enters perineum through lesser sciatic foramen. Branches, inferior rectal artery, supplies lower half of anal canal. Branches to the penis in male and branches to labia and clitoris in female. Internal pudendal vein, receives tributaries that correspond to branches of internal pudendal artery.